Thanks, Governor Kempthorne. I want to compliment you for focusing not only this plenary session, but really much of the governor's meeting on such an important quality of life issue. And I thought both of the presentations were very interesting and presented outstanding ideas. I do have a question for Eric. With the development of these new technologies, which are interesting, exciting, and probably limited only by our imagination, one of the things that strikes me is that we're going to have to create a comfort level with the people that are actually using that technology. And so my question is, how do you handle the privacy issue? How do you get people, seniors, who's ever using this technology, how do you get them comfortable with this new technology so that they don't feel like they're being watched, or kind of that big brother syndrome? And it seems to me that's going to be very important in terms of getting acceptance, in terms of how we use this technology, so they don't feel like they're under surveillance. For example, oh, my son has all this technology in the house to watch me, which might create discomfort. So how are you approaching that aspect of using this new technology?
It's a great question, and I'm glad you asked it. One of my concerns is that some companies use the sort of privacy fear as an excuse from sort of getting their feet wet and to try to go look. Because what we found is if you make it symmetric, and what I mean by that is we're putting some of the sensors in the home of the senior, but we're also putting some of the sensors in the homes of the other people who are part of their care network, so that it's not surveillance now, it's communication, and you're extending both sides' ability to kind of remotely notice things about each other. A lot of the companies that went out and tried to do this, that says, yes, it's the caregiver sort of looking in as God on sort of the activities that they're doing. I'll give you a simple example. We took people and put a simple pressure sensor that cost $12 at Radio Shack, connected it to that little wireless computer, and put it into their favorite chair. We use the internet, so all they got to do is sit down. And they sit down in their favorite chair, so when mom's sitting in her favorite chair, it turns on a lamp in the caregiver's house to let them know mom's sitting in her favorite spot. And then we do it vice versa, right? Daughter sitting here, turns on lamp in favorite spot. Now the adult children, when we did this, were like, oh my God, if my mom knows every time I'm home, the phone's gonna ring off the hook. It didn't happen. And what both parties reported was that they felt like, oh my gosh, I just feel safe knowing that they're there. Now I don't want to downplay the privacy issues, there's huge ones. And everything that we're building has security. And the challenge is to figure out, especially with people that we're studying who sometimes have power of attorney for themselves and sometimes don't, how do you design an interface in such a way that they can decide, my neighbor gets this data about how many steps I'm taking, my doctor gets this data, and that is a hard user interface problem that I don't want to sort of downplay. And that's something that's part of our research, is to figure out how do you design the system such that they can do that. But overwhelmingly, most of the people, once we study them and talk to them, are like, I'm on the verge of being institutionalized, or I'm trying to spend down and trying to figure out how to get a 24-hour home care nurse who's going to change every 3 months because of the turnover in that field. I'm perfectly willing to give up some step data and how restless I am at night to the people in my care chain if it's going to help. So it's kind of a both and. It's a really complicated issue that I'm glad you brought up.
Two more questions, Governor Granholm and then Governor Sebelius.
Actually, Governor Hoeven asked my question, so.
Okay, Governor Sebelius.
Thank you, Mr. Chairman, and I too appreciate the topic that we're dealing with and the fact that all of us around the table are learning good strategies for our own aging process. I'm thrilled that this research is going on, but this is for Eric. I know that from the insurance company standpoint, there were lots of battles and still are about telemedicine payments, how much third-party reimbursement, and some of it is very arcane, where you can drive a patient 120 miles and get paid for a visit, but if you're going to do it by telemedicine, there's still no payment. Looking at this and long-term care insurance, which often provides lots of home health services, recognizing it's better to keep people in homes than in a nursing home. It's less expensive. How much is the discussion going on with insurance companies about retrofitting homes and whether that could be paid for out of a long-term care policy? I mean, where is that discussion? Because it seems to me that may make a huge difference in how affordable available this is. Can you give us an idea of what the payment scheme looks like at this point?
Sure. One of the things I should say is that for a lot of the technologies, and this is a real concern for the future of HIPAA, actually, but a lot of the technologies that we're talking about are going to be sold direct to consumer. In fact, they're coming on the market this year. Honeywell, GE, a little company called Living Independently, are already starting to sell these kinds of systems. The crude versions, do they detect Alzheimer's? No. But do they let you know mom got home okay or is not sleeping well? Yes. So some of it's going to be direct to consumer, and it's going to bypass the whole Medicare discussion.
But if I have Medicare doesn't pay for long-term care
Right.
anyway.
Right.
If I have a personal long-term care policy, is this apparatus, machinery, technology going to be available to me in my policy coverage, or is that discussion even begun?
Some of the discussions happening within our CAST initiative, and some of the long-term care insurance folks are coming to the table, and it's one of the things that we've seen a lot of hope around is Senator Craig's Senate Bill 2077, which is the long-term care partnership. And one of our questions was, well, can we get a technology angle on that bill that says, maybe these technologies aren't ready for prime time, but part of that partnership needs to be the installation of these kinds of systems if they prove out to do that kind of thing. It's not well thought through at this point, to be honest.
Because it strikes me that's another thing that we could work on as governor. I mean, I think affordability may be well tied in many cases to insurance coverage. So if you have a policy, and we've already anticipated the technology availability, and that begins to be written into we bring the companies to the table early on, that may mean that the next generation of devices really is much more affordable to a lot of folks and can be installed much easier.
I think it means strange bedfellows and doing partnerships that we haven't thought about before. I think you're exactly right.
Governor Barber.
Eric, you brought up lawsuit abuse. You brought up the liability problem. Our state just passed a big tort reform bill. I'm not sure would have helped the people who are involved here. Does this have to be a national, a federal solution in order to get the technology companies willing to take the risk that they can do this without threat of litigation?
This is one of these things where, I'm this little social scientist who seems to have had this success catastrophe, and a lot of people ask me about this. I'm not a liability expert. All I can say to you is I've heard it from university researchers at all levels and companies at all levels in almost every state that the one that gets brought up, the number one application that we want to apply these technologies to is medication safety and compliance in the home. And it's the number one that all these companies and researchers avoid like the plague because they feel like they're going to get sued if they even go do a trial on it. I don't know what the answer is, and I'm not a liability expert at it. We're just trying to flag it and say, at all levels of government, it may well be that companies can protect themselves just fine with current law, and they just need to be educated about it. It may well be, and this is something I've been working with our CEO on, is exploring, can you do some sort of liability safe harbor at the research phase of these? We will deal with the product phase later, but at least to accelerate the research, can we do some sort of safe harbor around it? And I don't know what the answer is, but we'll stay tuned.
Very good. Well, again, would you join me in thanking these two outstanding